very pleased to be with my daughter Grace, Rachel Smith. It's always a beautiful feeling to have your daughter with you, whereby we can introduce a special program for the year. I love her very much. I want to tell you that on our programs, we try as very much as possible to bring that feeling of family to you, because at the end of life, when it all comes down, when the curtains are brought down, what matters the most is your family. Today in our families, we are faced with all kinds of decisions. We have to make financial decisions. We have to make educational decisions. We have to make sure that our children are catered for as they grow. But amidst all that, they take time out to go to school. They take time out to go on the playing field. And they are confronted with many, many issues. Some of the issues, we are trying to discuss it. And we have institutions that are set up to take care of our loved ones, whether it's the Bodley Correctional Facility. But today we are now looking at the Wellness Center. Not all family members are family heroes. Not everyone in the family does very well the way that we want them to behave. But sometimes they carry life's problems different from us. And the way that they face these life issues may be different from us. And sometimes we say that they are mad, they are psychotic. The doctor would make us understand what it is to be neurotic and psychotic. And so we think it's necessary that whatever stress that the family has, whatever you're going through, whatever questions that you cannot get answers for, and whatever problems that you believe that ought to be addressed in your family, before it reaches to the point where your child, your father, your wife, your children are supposed to be on medication at the Wellness Center, we think it's necessary that we have a conversation with a psychiatrist in the person of Felicien, Dr. Felicien. We'll be speaking to her shortly. But before we do, Grace will tell us something about her special song, and she will talk to us. Grace?
We will now have a special song, Take Me to the King.
Y'all gonna help me sing it? Yeah, yeah. Oh, my mind. Take me to the King. Thank you. Much to bring. Oh, thank you, Lord. Heart is torn in pieces. Oh, it's my offering. Take me to the King. Truth is, I'm tired. Options are few. I'm trying to pray, but where are you? I'm all churched out, hurt and abused. I can't face what's left to do. Truth is, I'm weak, no strength to fight, no tears to cry, even if I try. But still my soul refuses to die. One touch will change my life. Take me to the King. I don't have much to bring. My heart's torn to pieces. Lay me at the throne. Leave me there alone to gaze upon your glory and sing to you this song. Please take me to the King. Truth is, it's time to stop playing these games. We need a word for the people's pain. So Lord, speak right now. Let it fall like rain. Oh yeah, we're desperate. We're chasing after you. Oh, no rules, no religion. to sing to you this song. Going the way, we keep making mistakes. The chorus line for us, it's all for you. Take me to the King. I don't have much to bring. My heart is torn to pieces. It's my offering. Woo! Take me at the throne. Just to leave me there. Leave me there alone. I want to gaze upon your glory. And I want to sing to you. Sing to you this song. Take me to the King. Take me to the King. Take me to the King. King.
But you need a block that is solid as a rock. Building standing tall, stand the test of time. You got a rock solid block, the best in stock. The rock solid block is solid as a rock. Rock solid block will rock you, will rock you.
Rock solid blocks are built with uniform precision for fast, easy, and perfect installation, giving years of solid, dependable structures, standing as solid as a rock.
Rock solid block, solid as a rock, solid as a rock.
Rock solid blocks. The name says it all. Another breakthrough product from Wilrock. Visit us at wilrock.com.
Ladies and gentlemen, we are faced with a lot of issues in this country, but most importantly, we have a lot of things on our minds, and our minds are on some things. And for today's program, we want to focus on our mental health. Oftentimes, we have to take decisions. People tell us to think positively. Sometimes, some people believe that we are not thinking normal. Your wife may say you have a crazy idea. Your boss might say you're not thinking smart. And you really want to make sure that you have good mental health and that you perhaps eating the right foods, perhaps you're sleeping properly. What can you do to nurture your brain and to have mental health? Well, for the purpose of our program today, we have a very beautiful lady. And when I say she's beautiful, she is beautiful. I have never seen a beautiful lady like this, especially in red, this time around. So we have with us Felicien, consultant psychiatrist at the Wellness Center. She will tell us a little more about herself and help us understand our mind and how to take care of our brain as well. Dr. Felicien, welcome to Let's Face It. We are facing the issues of mental health and how we cope in our country today. Tell us a little more about yourself, Dr. Felicien.
Thank you, Mr. Smith, for inviting me to your program.
You're welcome.
I am Dr. Felicien. I am a consultant psychiatrist attached to the Wellness Center. I also work at the Borderley facility, and I do have a private office as well. I studied in Cuba. I did my first degree in Cuba. I graduated in 2005, and in 2013 I also graduated from the University of Cuba as a consultant psychiatrist.
Great, great. Now, moving away from the subject for the purpose of international information and relations, tell us a little bit about Cuba. Are you excited now, Barack Obama, the world's most gifted and favorite president have decided to build relationship with America and Cuba. Tell us about the Cuban life and what you think about the opening of negotiations and diplomatic relations between the United States. What do you think about it and Cuba?
I'm very happy to know that Barack Obama has decided to change the whole 50 years revolution embargo on Cuba. And living in Cuba makes you a different person. It prepares you for the world. It makes you more humanistic. It makes you understand, and it gives you a different culture. It helps you to understand people, understand family, and every person, I could say, who studied in Cuba has an adopted family, a Cuban family. And I'm sure your viewers who have studied in Cuba would agree with me. So Cuba is not only teaches academically, but it helps you to develop your skills as a person, a people's person.
Okay, I'm talking about illness. Let's get back on track. Tell us a little more about your field as a psychiatrist and your job as a psychiatrist at the Wellness Center. Where do you start? How do you diagnose a chronic illness? What is a chronic illness?
Okay, as a psychiatrist, psychiatry is, I think, one of the best parts of medicine because it also deals not only with the mind but with the individual. So it's like looking at a holistic person, and not only, if you go to an eye specialist, the eye specialist probably would get a bit of history and concentrate on the eye, right? A pathologist would concentrate on his part. An orthopedic surgeon would concentrate on his part. However, if you come to the psychiatrist, the interview is a bit longer. It lasts maybe 2 hours or more, because then we deal not only with the person, but you deal with who they are, where they come from, and what you think that you could do for them. So we look at not only the individual and his illness, but what in the society associates him to be ill. So psychiatry is very interesting. It's more like dealing with a person, more people's specialty than just a different part of the body.
All right, great. But Dr. Felicien, you think there's a difference between a psychologist and a psychiatrist? If any, please tell us.
It's not that I think there's a difference.
What's the difference?
There is a difference because a psychiatrist is actually a general practitioner, a doctor, who studied medicine, who went through the 5 years of studying the body, right? And then, like any other doctor who's going to specialize in a field, for example, a neurologist, a nephrologist, an orthopedic surgeon, a pediatric doctor, then that person decides to specialize in psychiatry. And the difference, one of the main differences that you would be able to pick out is that a psychiatrist is, since he studied pharmacology, can now prescribe medication, whereas a psychologist cannot. Did I say? Yeah. Okay, so a psychologist would not be able to prescribe, so they cannot write you a prescription, whereas they go for almost the same training, but they do not do the basic parts of medicine as a general doctor. So they are a doctor in psychiatry, in psychology, but they're not a physician.
Okay, understandable. Now, you said earlier about your community. They told me you're from Moshi. Is that true? Is that true?
Well, my dad is actually from Riviera, right? But I am not from Moshi. I grew up in 44 Chisel Street, Castries.
Okay. Having said that, I want to take you back home because we have our darling daughters and our strong sons. Everybody looks and they have their own take about life in St. Lucia. I just want to get an opinion from you in regards to women's issues and gender as a psychiatrist. When you hear about situations that women are being raped, especially recently we had an elder lady from Monrepo, it's very sad and disgusting. She was saying that, somebody tried to rape an elderly 91 years. You heard about at the Shock Beach, a young lady about 21 years, she was attacked at gunpoint and knife, etc. And how does it feel as a lady? I mean, put the lady's eye, a woman's eye as a psychiatrist. Is there any difference? Or can a woman's instinct help other women much better than the male instinct? Just, I'm not trying to be gender conflict, but I'm just saying, what is your take on that? Do you have more than, as a woman, a greater sense than a psychiatrist? How do you involve your womanistic, your gender issues going forward to help women and addressing women's issues?
Well, that's a difficult question,
Okay.
but let me see if I could try to help you.
Sure.
As a woman, I think women are more sensitive. I don't want to make the men feel like they're
I'm
not.
going to defend the men.
However, women are more sensitive and they are more family oriented when it comes to being, because they're the mothers, right? And
Nurture.
if you know, if you recognize or realize that sometimes people actually say when the mother is not available, the family falls apart.
Okay.
So women are sensitive when it comes to nurturing, when it comes to caring. However, when it comes to medical illness or psychiatric illnesses, there are a few personality disorders that are more prone, that you see more in women than men.
Okay.
However, most of them are equally, or for example, when we go into suicide,
Right. Very interesting subject.
men take more lethal methods in suicide. So when somebody would call me and say, I have a suicide patient, the gender or an attempt, a suicide attempt, the gender would actually mean something to me. Why? Because I would think a man, or the research has shown that men take more lethal methods.
Okay.
So a man would probably use a gun, or he would try to hang himself. However, a lady may use tablets or may slash her wrist, right? It's not that is not important, but it actually gives me an idea of who I'm dealing with. So when it comes to gender, maybe sometimes we have to be alert, especially in psychiatry.
Now, before we take a break, what are the steps, if any, you can recall in approaching somebody who has been raped or somebody that says that they have been raped? What is, from your medical background or from your experience, give us at least something to understand. When somebody is raped, what are they going through, especially a female?
Well, the first thing, I guess, is a trauma, because a rape is like, it's an emotional trauma to the person, whoever is going through it. And of course, it doesn't matter. Sometimes people tell you it's their husband. Somebody can be raped by their own husband or their boyfriend. However, it's a trauma because it's not a two-way participation. So then with that trauma, of course, we could expect anxiety, we could expect depression at a later date, and we could expect instability. So this is, and of course with instability, you could also bear in mind that there is maybe thought of suicide or shame or not wanting to go through, not wanting to talk to. So of course, as we continue, I will actually let your audience know how they can help us, because apparently most people think that if I'm ill, I need to go straight to the psychiatrist. But of course, we can actually tell people what to do, because sometimes the first responder is not a psychiatrist. The first responder may be a nurse, maybe a friend, maybe a family member. So then after the break, I'll be more than happy to let you know how we go about
wonderful so far. Well, ladies and gentlemen, we are very pleased that Dr. Felicien has already begun on a very positive note. We shall take a break, and when we return, we'll continue where she left off.
But you need a block that is solid as a rock. Building standing tall, stand the test of time. You got a rock solid block, the best in stock. The rock solid block is solid as a rock. Rock solid block will rock you, will rock you.
Rock solid blocks are built with uniform precision for fast, easy, and perfect installation, giving years of solid, dependable structures, standing as solid as a rock.
Rock solid block, solid as a rock, solid as a rock.
Rock solid blocks. The name says it all. Another breakthrough product from Wilrock. Visit us at wilrock.com.
Dr. Felicien, interestingly, we spoke about the input of others in regards to somebody who has gone through a rape experience. Where do we start off? How do we continue that conversation about the rape issue?
Actually, I don't want to specify. It's not only rape.
Right.
What I want your viewers to understand is that sometimes, even if it's a suicide, it's a depression, it's anxiety, whatever it is, it's a problem, it's a stressful event. Maybe they fire you, maybe you have lost something, a loved one, a job, whatever it is. There is a specific way that I will let your viewers know how to go about just providing assistance to whoever person who has come to you, okay? Because it's very important that we learn that, because we can also give assistance, psychological assistance, and that will help. Actually, it will help the patient go a little bit further before they get the professional help, because a psychiatrist cannot be everywhere.
That's right.
At the same time, and there are only 3 on island. And we cannot be in all hospitals, all emergency rooms. We cannot be in every family home. So one of the first things you can do is give a listening ear, okay? So you listen and be less judgmental. And that's important, because most people now say, if it was me, I would have done, or why you had to go there? They wrecked you because you were in the dark corner.
Okay.
Or so you don't be judgmental. So whatever. So you listen to the history or whatever the person is going to tell you. You don't judge. This is why most people say you have 1 mouth and 2 ears, right?
Yes.
Right. Okay. And then you go on and make yourself, or as a person reveals the story or the history to you, then you kind of connect with that person and putting yourself in that person's shoes. Right? But still, do not give any advice. If it was me, I would have punched him. If it was me, I would have given him a slap. Okay, so you just listen, and as you go along with the story, then you convert and you become that person. You listen, you become that person. Then, of course, at the end, you decide what is the most appropriate thing to do.
So what you're saying there makes a lot of sense. Have you heard about passive listening and active listening?
Yes.
All right, now we come into that. In developing a therapeutic community around someone who has gone through some trauma, some problems, some loss, how do you listen actively, and what is passive listening?
When it comes to passive and active listening, you are actually dividing it, but I don't think we should divide it. I think it could both be passive and active, because of course you cannot just be like a block and just listen and then the person's like, you heard what I said? Right. So you cannot go into that. Okay. However, if you follow my guidelines, then you will understand when you come in, right? So you listen, you put yourself in the person's place, you go through the experience as they do, and that now gives you the ability to feel what the person is feeling, okay? And after, then there's a plan. You have to come up with a plan, or you and the person together have to come up with what next to do. Sometimes that person is in the state of mind where their plan is not rational. Okay, for example, if this happened to me, I would think of taking tablets, or I would want to kill myself. But of course, since you're listening, right, and it didn't really happen to you, but you understand really how I feel, right, you'd understand that, yes, I probably may want to do that. But then this is where you come in and you say, I don't think the appropriate thing is to end your life. I think the appropriate thing is probably go to the authorities. The appropriate thing is to seek help from a professional. So then this is where you come in and you give your advice.
So what about paraphrasing? For example, they tell me in active listening, you can say things like, I heard you said, I understood. Like you say what the person is saying with different words or with other words. What about paraphrasing or repeating what the individual is saying to give a sense of understanding rather than just nodding your head?
Okay. You're not going to paraphrase to give a sense of understanding. You're going to use it as to clarify For example, if I say that I don't think that the future is very bright, so then you're going to say, I believe that you're saying that you don't want to continue living. So then you're going to clarify, because you really want to know whether or not this is what you're understanding from that conversation.
And you want the individual to understand that you are listening the best way that you can, so that you can give them a sense. Yeah. Going forward, let's go a little more back to your profession at the Wellness Center and the clients that you see and the medication and the approaches that you take. Tell us a little more about that. Your clients, treating your patients at the Wellness Center.
Okay, in the Wellness Center, we see more psychotic patients than neurotic patients. Psychiatry is divided into two major groups, which is the neurotic patients and the psychotic patients. Now, the psychotic patients are people who function without, like not functioning in their state of mind. So they function out of reality. They are what we normally know as mad. Right? However, the neurotic patient is not recognized by the public. So sometimes you would say, oh, that person looks like they have a loose screw. But then, of course, they function. Okay, so of course, we have neurotic patients like persons with personality disorder, anxiety disorder. These are neurotic patients. However, in the hospital setting, we do not see so many, because it is, most people have this stigma. I'm happy that we going into stigma. Most people think that if I go to the hospital, they'll think I'm mad, or mad then would be psychotic. However, mental health does not mean that everybody is psychotic. Okay, so you have neurotic patients, and of course in depression, and most people doesn't even know that there is a psychotic part of the depression, right? So you could be depressed with psychotic features, or just depressed without psychotic features. That is not to scare people that if you're depressed, then you may become psychotic. This is not it. It's just that to explain that it's not everybody with a mental illness is mad. Most people have or psychotic. Most people are, they sometimes need to sharpen up on their coping skills. They need some supportive psychotherapy, which we do at the Mental Wellness Center. And of course, just learning how to understand yourself, because sometimes people don't even understand their own self. So learning how to understand and how to react in certain situations is actually helping and supporting persons to live a healthier life. What about insomnia? Most people say, I don't sleep, right? And because they don't sleep, they figure, oh, that's okay. And that is dealt with a psychiatrist. I had the opportunity in 2007, I think, or 2008, to conduct an observation period in Taiwan. And there is a very big sleep lab in the psychiatric hospital where they actually study the different stages of sleep. So then persons would go into the psychiatric hospital and just for insomnia, whereas here we don't see that. Most people just go to the general practitioner or go to the doctor and say, I cannot sleep. But that falls under psychiatry, because sleep can be a symptom or a diagnosis. Insomnia can be a symptom or a diagnosis. So then we have to understand where this is coming from.
What you're saying there is very interesting. Earlier on, you spoke about being psychotic and being neurotic. Right? Now, you said psychotic is when people coin it as being mad. Neurotic, it means that maybe you have some kind of mental health.
Anxiety disorder.
Yes, okay. Now, what is a disorder? Just generally speaking. When somebody had a word disorder, what does that mean? Okay, a disorder is actually, it's not functioning well. So it's not order, it's not in order. It's a disorder, right? Or it's an illness. We say disorder or illness, right? But normally we use the word disorder just to say that it's an illness. Okay? For example, a sleep disorder is that you're not sleeping properly, so you're not well. Now, going back into the sleep disorder, just so that your audience could understand when I talk about sleep disorder, if you have problems falling asleep, that's a disorder. If you have problems staying asleep
For example, I fell asleep. I have no problem falling asleep,
Right.
but I cannot stay sleeping until 6 a.m.
Okay.
That is a disorder.
Okay.
And very interesting, if I sleep all night, I fell asleep well, I continue sleeping, and when I wake up, I do not feel well rested. I feel
Okay.
tired, like I
Okay.
never slept.
Okay.
That is
So
an
I think
insomnia.
most of our viewers can identify with that. Now, going forward, what kind of help you would suggest? Some people, they boil cortisol. You know what's cortisol? Cortisol leaf.
Yeah.
There's some guys that may take certain tablets over the counter and thing. But basically, tell us, where do we start when we're not falling asleep, or when to stay asleep?
First, we need a diagnosis. Don't forget, you cannot just say, okay, I'm not falling asleep and I'm going to just start cortisol leave and whatever else. No, this is not how it goes.
Okay.
First, then if you're not staying asleep for a period of time and it becomes a problem and you cannot deal with it, then you go to your doctor,
Okay.
and then the doctor tries to see whether or not he can solve the problem. If he doesn't, then he sends you to a specialist, and this is where I come in,
Okay.
where we deal with it. First, then I have to find out the holistic patient, because don't forget, you're not falling asleep is just not you. It's Mr. Smith not falling asleep.
Okay.
And what is good for the goose is not good for the gander, because Mr. Smith may have problems at work,
Okay.
and that's probably why we have that problem. Or Mr. Smith maybe have nothing, right? And this is so we have to actually see the patient, make a diagnosis,
And
come
then-
up with what. And sometimes all of this doesn't happen at the same time. However, first things first, Mr. Smith is not sleeping, so I try to make you sleep,
Okay.
right?
Giving me.
We at the Wellness Center do not use traditional. I will not tell you, okay, 2 cortisol leaves, right? That's not what we do here. However, firstly, I will give you some medication. There are lots of medication to help sleep. Okay, so that I would do.
What about a blood
Prescribe.
test? Blood test not necessary.
Depending on what I suspect.
Okay.
Because don't forget, I have to make a diagnosis.
Right.
And if there is a medical illness, for example, I figure, okay, Mr. Smith has a brain tumor, and that's probably why he's not sleeping, then I'll
Okay.
send him for a CT scan, I'll send him for a brain x-ray, depending. So it's not for every pot for a storm or something
Yes,
like that. That's
okay.
how they say it, right? So it's not every patient is an individual. Everybody is a particular person.
Look at anything common
But I
with
could,
your
what I
clients,
could do is I can educate them on the sleep hygiene.
Okay.
I could tell them certain things that they can use to fall asleep.
Like,
For example, your bedroom, the colors of your room, the amount of light that comes into your room has some. If you cannot sleep or if you have problems falling asleep, then the amount of light may have to be decreased.
Okay.
The colors, the bright colors in the room is not conducive for sleep. Some people use their bed for everything else except for sleep.
Okay.
So some people would read, some people would be on the internet, some people listen to music, and these are not conducive if you have a problem falling asleep. However, if I do not have a problem falling asleep, then I can do anything and fall asleep. Some people fall asleep at the parties,
Okay.
right?
Yeah. Now, before we take another break, what about the time you go to bed? They tell me anytime you sleep before midnight, the body benefits more in terms of what is being secreted by the brain. Is there any wisdom in that, going to bed early and getting up early? Tell us a little more about the brain's reaction to early sleep.
Okay, so what I could let you know is that everybody's different.
Okay.
Okay, so there's some people who don't go to sleep early, and some people like me at 6 o'clock or 5:30, I'm in bed and I would sleep until 6 in the morning.
That's why you're so beautiful.
Maybe that's called a beauty rest. So it depends.
Okay.
So that's why when you have a problem, I have to know who I'm treating and what surrounds the problem. Because some people don't sleep because they worry. Some people don't sleep because they have a stressful event. So everything is different.
Has to be
So
your reaction has to be tailored, has to suit based
Suit the
upon your
person.
discovery and your investigation.
And if you have an illness, for example, maybe as I said before, brain tumor or something, I don't want to scare people and tell them that because you have a brain tumor you cannot sleep. That is not it. But sometimes some illnesses can associate with insomnia.
Okay. Dr. Felicien, when we return, we're going to have a break, but we're going to talk about our youth. Are they really restless in schools? What have you observed at the Wellness Center? And going forward, what are your recommendations concerning our young people in the country today? Dr. Felicien, we have been really been enjoying the program, but more importantly, we have been enlightened. But we now need to focus on our young people. I mean, when you think of our young people today, we look and we hear about many things in terms of suicide. Not too long ago, a young man took his life, and it was very sad. We hear about our young people at schools, the way they're acting out. It does not seem to be normal in terms of the high interest in sex and sexuality and all the other issues. I'm quite sure you meet many adults, and you also cater for young people at the Wellness Center. You have discovered a few things, plus you have your own observations. Tell us what it's like working with young people in your institution, and what views do you share presently about our young people today?
The young people, I think we need to, as parents and healthcare providers, we need to show them more coping skills. I think there's a quick intolerance to a lot of things, a lot of problems that they face. And facing it now, when I grew up and when you grew up, it's totally a different world. The amount of drugs offered to us, the broken homes that we have, single parent homes, and of course, this is really my opinion, but I know how hard it is for mothers to be the sole providers for their kids and still have to go into work and be a mother. That's like having two jobs. So then I believe that most of the people we see, most of them come from broken homes, most of them have parenting skills, disability, especially for the younger people, because before, I guess, when I was growing up, you had to be married to have kids. You remember when the teachers they couldn't have kids if they were out of wedlock.
Yes,
you remember that?
Married, yeah.
But now, I guess that was religion taking its course and constructing the society differently. Right now, I drive down on a morning going to work, and instead of a normal conversation between parents and children in the car, I would see the kids with their headphones and the parents on their phone talking about work. So we really have to maybe take a little bit from the old and go and try to correct it, because society has then changed drastically. We have to move on. We have to provide. How many of us have breakfast with our kids every morning? How many of us know what's going on with our kids? And as I have been saying, and I will always say, your kids have to be their best friend. So when you ask your daughter, who is your best friend? She should say, my daddy or my mommy. So then with that, you give them the support, because what they need is support. And for different kids, for different age groups, you have different form of support. And that is something most of us don't know. Why? Because there's no book that says how to take care of Tom until he reaches 16, or how to take care of Dick until he reaches 16. However, my advice to the parents out there is to be your kid's best friend, and there is different recommendations for different age groups. For example, if you have a toddler, you are requested to tell them this is what you do and this is not what you do, and so on. However, if you have a teenager, then there is a different form of approach.
Talk with them.
You're right. You talk with them, you learn with them, you know them, and of course, for you to handle a situation, if you know everything, then you would be able to curb the problem before it becomes a problem.
Okay, I remember telling my daughter when the time is right for her to have a boyfriend, I don't want she and the boyfriend to be talking somewhere away from the house. I want him to be sitting in the living room, and I want to monitor the conversation at least at the beginning. Why should she have conversation with her boyfriend somewhere in the schoolyard? I don't know the boyfriend, or somewhere by the beach. I don't know what's happening. So I think yes, in fathering your kids, you have to play a role. You have to give a sense of not just concern, but empathy. And also I discovered that most young people have a great need for understanding. What is your take on that?
I agree with you. I agree that most, especially the teenagers are battling with a lot of things in life. And of course you were a teenager. And what you used to battle with, I guess that's what your mother did not battle with it, or your great grandmother did not battle with it. So as we go as society, as we have progress in society, then we have bigger challenges and greater challenges. And I remember one time I had a patient who actually said to me, "Doctor, what you went through when you were going to school is not the same." And that's what my mom doesn't understand. Of course, we have more challenges. We have drugs being offered at school, and I guess people are being tempted to, as teenagers, one of the things that you expect from teenagers is to try out different things. So one day you'll have your daughter coming home with pink hair, and the next day she'll shave it all off. Yes, so they experiment.
I put my wife on the spot. One day my daughter said she like the thing like they have a whole hairstyle like what you have in your hair. They call it there's a term that they use.
A donut.
A donut. You got it up. So my daughter said she's not a little child anymore. She wants a donut. I said, what's going on? What's a donut? You know. And I said, no. I'm gonna give you plats. I'm gonna give you plats. And then a big argument took place in the house between donuts and plats. And then my wife was getting mad. No, says I'm about and they developed that attitude, telling the children, you must put what I give you. You must look the way that I want you to look as a mother. I'm telling you how to dress. You're not gonna tell me what hairstyle you are. And I listened to the conversation between my growing daughter and my wife, and I was caught between both of them, between a donut and plats. And then I said, sweetheart, can I speak to you? We went, let's go in the bathroom. I need to speak to you. I said, sweetheart, the child has a taste. You have your taste. And you cannot control her the way you would like to. She's growing physically, so there have to be some negotiations. And then my wife said, you talk to her. I said, baby, that's not the attitude, but she's growing. And so I agree with you that the teenagers nowadays, the pressure that they encounter is not the same like what we had. And what about the issue of Facebook, Twitter, and all the other communication and technology? Do you think that's interrupting to an extent the level of bonding that should take place between children and parents nowadays? What's your take on that?
I think the parents need to recognize their challenges. And their challenges may be the Facebook. I don't think Facebook is bad or Twitter is bad. I think we should make time, family time. This is something we do not have time for. St. Lucia has changed drastically, because I guess when I was growing up I had a TV until midnight when you had the Barbados channel. You remember that?
Yes.
However, now CBC. It has BBC, BBC, right? CBC. Yes, CBC. It has changed. It has changed. So now you have 24-hour TV. You have, so now it actually, what parents or working parents do is use the TV as a way to keep the children quiet whilst they continue to do their housework, etc. But then we have to remember that we are growing young people and we prepare them for tomorrow. So the more family time, the better. We cannot stop them from technology because it's there and it's in our face, and it's good and bad. So they use it for school and they may use it for something else. However, if they are our friends, if we are growing up with them, you see what most parents think is, I am the parent and you are the kid. No, it's more of, we are the family and we are going to do it together, and we're going to go to the beach and we're going to have breakfast together.
Home. It's our house.
Right,
It's
right.
our family.
If we make it our
Family.
then you don't have to say go and clean your room. How
Yeah.
many times I have spoken to young people and say, where do you spend your time? In my room.
Okay,
You know,
right.
it's not really mine, it's
Okay.
ours.
Okay, now what about the mother is saying, get off my chair. The father is saying, get off my car.
Right.
Us rather saying, the
Yeah.
car, the chair.
If you're
you know,
not paying attention, if you're not listening to me, I'll
Yes.
put you out of
my house. Yeah, that's how they sound sometimes.
Yeah,
right?
so that we just have to be cognizant of the words we use, because
To our kids,
of
yeah.
course not only to our kids but to everybody,
Sure.
because some words we have to know how to use it. For example, you are, you see, when you use the word you actually stressed,
Okay.
and then you can aggravate
It's the
instead
person.
of
Okay.
helping. You
Right.
understand? So it's what we do and how we do it, and parents need to be
Yeah,
cognizant
because
that the kids.
I really believe that parents, I do believe that the greatest need for your child, or the greatest need you can address, is understanding. You know, I want to say to our men, I'm the chairman of our board at home. When when we have our family meetings, whether we disagree on any issue, I think men should call the family together and discuss what's on the agenda. We're going to discuss finance. We're going to discuss family time. We're going to discuss education. And the man being the chairman of the board have to get views from each member, discuss the issue, and then decisions will be taken in such a way that will advance the family. Now, we are now going to the issue of myths and medicine, etc. But before we do that, we'll take a quick break. Is that okay, Doc?
Yes, it's
All right.
But you need a block that is solid as a rock. Building standing tall, stand the test of time. You got a rock solid block, the best in stock. The rock solid block is solid as a rock. Rock solid block will rock you, will rock you.
Rock solid blocks are built with uniform precision for fast, easy, and perfect installation, giving years of solid, dependable structures, standing as solid as a rock.
Rock solid block, solid as a rock, solid as a rock.
Rock solid blocks. The name says it all. Another breakthrough product from Wilrock. Visit us at wilrock.com.
Doc, I mean, your practice as a psychiatrist, I'm sure you have to administer medicine. And sometimes people use other forms of medicines, traditional medicines, and sometimes they prefer that medicine. And sometimes they get confused with a previous doctor. How do you go about, and how should we look at issues of medication and the myths surrounding medication?
Well, in the wellness center where I work, I have a very common myth.
Okay.
And people say, don't give him injection.
Okay.
Because when you give him injection, you're making him walk like a robot, you're making him do this and that. Okay,
Right.
so most people are afraid of injection. And I always ask them, but when you go to Victoria Hospital or when you go to the General Hospital, do you say don't give him injection? No.
Okay.
But then you see they associate injection to being stiff, injection to walk like a robot. But actually, there are lots of myths, but that is the most common one that we get.
Injection.
It's actually in psychiatry, since most of our medication is brain altering, it's alter substances in the brain, then of course every medication, not only psychiatric medication, everything has side effects. And of course, the side effects, one of the most common side effects that we see here in psychiatry is the stiffness. And it's actually a side effect.
Okay.
However, when you start explaining to the patient, because as a doctor, it's your responsibility to let them know what are the desirable side effects and undesirable side effects. So they wouldn't be afraid and run and say, oh, I think I'm dying. So you tell them, if you take that medication, you may become drowsy, you shouldn't operate heavy machinery, etc., etc. You may become stiff, your mouth may become dry, etc., etc. It's not to scare, but it's just that you have the knowledge. So if it happens, then I say, if it happens, then you come back to me and I will see what I could do, or I could give you another medication to help with the side effect. And also, so that the patients will be educated. The thing about psychiatry now is education. Everybody's afraid of psychiatry, and most people are afraid of psychiatry because they don't know about psychiatry. So they figure, you working there, you should be afraid of these people. You're not afraid of these people, but they are people. There's somebody's Mr. Smith's brother, Mr. Smith's uncle, somebody's son. So they are people.
Right, that value have to be given to them. They are equally human beings like us. They have the same value. But what about you heard a lot about community therapy and community assistance, and we as persons living in the community, when we have somebody that has a mental illness, somebody that is, psychotic is when they're mad, neurotic is when they
not when they're mad. Psychotic is when they functioning out of reality, but don't make it look mad.
Don't look mad. They're not.
Because you stigmatizing.
Okay, so how do we deal with people who do not act normal within our community based upon medication? What's the right approach we should have? Okay.
Now, in our hospital, we have the community setting. It's not part of the hospital, but it's part of the Ministry of Health. Okay, so when we admit a patient in our hospital, we prepare them. It's called rehabilitation. We prepare them to function as they were in the community. So from admission, we start with treatment, and one of the treatment forms is rehabilitation. Okay, so maybe that patient will not be able to function at 100% like you and I may. However, because you have mentally retarded people, but that doesn't mean they'll not be able to function in a society. However, we will prepare them as close to be a normal person in society. Okay? So part of our rehabilitation starts from combing your hair, brushing your teeth, going to bed at a certain time, and all of that is supposed to be assessed before the patient is discharged. Now, if there is a problem or something has not been met, that doesn't mean it prevents the patient from being discharged. We actually have something called a referral form, which we use, and we refer the patient to the community nurses, the psychiatric trained nurses, and these nurses are to follow up. So they will follow up on the medication. They will follow up in the living in society, in the rehabilitation process. We have an OT department, which is occupational therapy at the hospital, and this also helps patients find something to do. Most of our patients are work-related, as in to train or help with a skill. Now, most of our people are farmers. Most people, they farm. So we have a little, not too big, a little garden where we continue. Okay, so they learn a little bit more. We're trying to get other agencies involved, like agriculture and so on, to help us, so you could help them. Okay, we also do craft, a lot of little craft, projects.
Like
sometimes
crochet,
like crochet, like knitting, like papier-mâché, etc. Now these things are on display most of the time at the hospital in the OT department, and when we have our special days like mental health days and so on, we show off.
Is there that successfully rehabilitated? Are there relapses? What's the difference? What is your success rate at the wellness center, if any?
Well, there is, of course. It's a lot of hard work, and we always need support. We cannot do it by ourselves. Because we have 3 psychiatrists for 170,000 persons, right? Not everybody mad, but the population of St. Lucia is 170,000 people, right? So then we need support. I need you, and this is why I am very excited about your program
Yes,
because
I'm
I
very
want
happy to be here.
every listener to give me the support I need. We need family support, we need neighbor support, anybody who could help us in a way that we could have St. Lucia as the ideal. You never have the ideal community, but we need to go towards that goal, right? So as we work together with the Mental Wellness Center and with the community, we need to go ahead and see how best that we could have the perfect setting for our mentally ill patients.
Okay. I really want to thank you, but before I do, what are your departing words or your conclusive advice in the, as we look at the new year, many people will expect many things. Some things might happen that will surprise us. We have to make decisions. People talk about New Year's resolutions, etc. Give us some advice as we deal with major decisions in our lives. How do we cope?
Okay. I want to let everybody know out there that be your brother's keeper. And when you cannot or when you think you need some help and support, we are available. It's a hospital. Okay. Our hospital doesn't close down. We are available 24 hours a day. You could call the nurses. The nurses would be able to orient you or tell you what the next step to take. And of course, one of the things that most persons do not know is that this is a specialized hospital, so you cannot diagnose yourself. You cannot say, I think I have a mental problem. You need to see your general practitioner, who is now going to maybe orient you with the diagnosis and get a referral and come to our hospital, and we are willing and we are always ready to help.
Wonderful. Dr. Felicien, thank you so much for allowing us to come to your office and to be at the Wellness Center. Thank you so much and God bless you.
You're welcome. Anytime.
We really want to say also, ladies and gentlemen, that we see the need for Back on Track to be working with not only counselors and psychologists, but psychiatrists are very, very important because they bring in a medical perspective, and sometimes we don't actually see our brain, but we know we have a brain. And as a result of that, because we know we have a brain, we need to take care of the physical aspect and deal with whatever medical or medication that we might need when we have to deal with our mental sickness or our mental problems. So there are sometimes we can deal with stress and depression by conversation, but other times it is necessary for us to take medication. So as you continue to make major decisions in your life, as you continue to wrestle with the way to go in life and what to do and what not to do, remember that your decisions are the hinges of your destiny. Every decision that you take swings wide open to something good or something bad. Every decision that you take swings wide open to a better family or to a more difficult family. Every decision that you take swings to a better future or a brighter future or perhaps a darker future. But I hope today you will make the right decision. As you go forward throughout the coming year, you will find it necessary to think and to think positively and make the correct decision from time to time in this life. Life is very short and death is short. But I tell you this, sin is the cause and Christ is the only cure. I know of no other savior, no other way out of this life's problems than to lean on the everlasting arm. So as you go forward, remember this, trust and obey, for there is no other way to be happy than to trust and obey. Trust in the Almighty God. Call him Yahweh, call him Jehovah, call him whatever you have been taught to call him. But remember, we cannot escape the creator of heaven and earth. So put him first and put him always in your life, and may God bless you.